just really, really thankful for you taking the time to be here and to be more aware about this disease, preeclampsia. So I am a person of faith, so I am going to pray. That's okay. This is just who I am. So I'm going to just pray as we open up, and then we are going to move forward. So, Father, we just thank you so much for this time. Thank you for just the privilege of even being here, God. God, for your miraculous power. We ask that you bless this time. God, we thank you for our panelists that have sacrificed their time to be here on today, for all of those who are here to hear. We thank you and we praise you and we give it all to you. In Jesus' name, amen. Amen. All right. And so, again, on today, we are celebrating. Today is World Preeclampsia Day, May the 22nd. It's also Preeclampsia Awareness Month, the month of May. So a lot going on this month. I know that I've talked to people on yesterday, and some people didn't know what preeclampsia was, and that's why we're here today. We want to make sure that there's complete awareness of this disease that it primarily affects African American women. And I know we have some young ones here who maybe are still in childbearing age. Thank God I'm not. Hallelujah. I've done my job. Amen. I've contributed. My quiver is full. Amen. But so we want to make sure. And then just for your daughters, your granddaughters, your nieces, all of our family, generations to come that need to know what is possible so that they know what to do. Amen. And so I think I'll start off by doing an introduction of all of our panelists on today, and then we'll go from there. So I'll start down here. Yes, say it in order.
Oh, okay. Well, good afternoon or evening, everyone. My name is Renee Mahaffey Harris, and I'm really blessed to be here to join you in this conversation. What else would you like me to say? Who am I? Well, I am first Renee Mahaffey Harris. What I have the pleasure and am blessed to be able to do is be the president and CEO of the Center for Closing the Health Gap, as well as the founder of the Black Women's Health Movement, and I think a child of God working to empower us with the knowledge we need to make sure that our health and the health of our children and families is better.
Hi, I'm Antherica Lane. It's nice to see all of you this evening. I am an OBGYN in the city. I currently work for TriHealth. I work out of Good Samaritan Hospital. I had my own practice for about 4 years, Lane Women's Health, right there in Finneytown. So now I am aligned with TriHealth, very excited about moving into our new facility, and really excited to be here and humbled by the invitation, and just what a vision to talk about this subject. I'm a preacher's kid too, so I love the prayer. I appreciate that, and it's wonderful seeing you all.
My name is Anicia Gandy. By profession, I am a skill instructor at Center for Employment Training through Brighton Center in Newport, Kentucky. But I am a preeclampsia survivor. So I too was absolutely floored and humbled by the invitation, and I'm just grateful to be here.
Hi, I am Kay Hayden. I am a nurse home visitor, a doula, and childbirth educator. I'm a nurse home visitor for Every Child Succeeds, and I do a lot of community and birth work. I'm also thankful to be in this space with you all, and thankful for the invitation as well.
You check to see if your mic is on. You see a light? Okay, yeah. Okay, very good. Welcome. Let's give them all a hand. Woo! So again, just excited to be here. I think I'll start off just kind of telling my story and how I ended up in just being so passionate about preeclampsia. Almost 21 years ago, which is crazy to think about now, I was expecting my third child, which is rare, because preeclampsia typically happens with the first child. At least that's what that's what they believe. And I was carrying Emmanuel, for those who know Emmanuel. I was carrying Emmanuel, and I had a couple of different warnings early on. Ended up spending a week in the hospital in another city. Long story. Anyway, it was just the beginning of issues that I was having, but no one really recognized what the problem was. Long of the short, I had began to swell. I swole so bad that I could no longer wear shoes. I was like double my size. If you know anything about when you hold water, when you can press in your skin and it just stays a dent, that's how much fluid I was retaining. And I'd been to the doctor several times. I had a doctor of another persuasion, and I was going back and forth. I kept telling him, saying, I just don't feel well. I'm swelling. They checked my protein, and we'll kind of talk about that in my urine. They saw that. All the signs were there, but he kept on saying, it's okay. But it's okay. My pressure was going back and forth all the time. But they would always send me back home and say, but it's okay. And so it got to the point where one night, I'll never forget this night, I literally was crying almost all night long because every time I would try to lay down, I had this horrific pain in my stomach. It's like my, I guess, abdomen area. And I just could not take it. So that morning, I guess I talked to my sister, and she'll be in here in a minute. She has her own story. I talked to my sister and kind of told her what was going on, and she said, "That's crazy." I'm like, I don't know, but I feel so bad. Long story short, they were at a family reunion that I was supposed to go to, but I couldn't. And my cousin, who was a doctor in Chicago, she said, "What are your symptoms?" She said, "Okay, I need you to get your bag, tell your husband to get you to the hospital now." I'm like, okay. I go, exactly what she does. She gave me 2 tests to give the ER doctor. I went there. My doctor was out of town by God's grace, because I don't think he would have even taken it serious. He probably would have been offended that I had information from another doctor. So the ER doctor was like, okay. He immediately took it. He ran the test, and he said, "We need to deliver you now." My liver was malfunctioning. My platelets were, I don't know, whatever it was so bad that they were very, very concerned. So they induced me right away. Thank God I was able to deliver normally because it was so quick. It happened so fast. But the problem was, as soon as I delivered, and if you know anything about preeclampsia, delivery is supposed to be kind of the beginning of the reversal. Well, mine seemed to be going the other way. So when I delivered, it was like bells going off everywhere. It was like the whole room was like loud. People were running around, and I felt like somebody was beating me in the head with a hammer. And I don't even remember seeing Emmanuel when he was born because it was so bad. My head was hurting so bad. So what happened is my condition had gotten so bad, I went too long in the condition that I was in. And so for I don't know how long, I was back and forth to the hospital. They were concerned about stroke. I mean, I was just back and forth for like 4 months before they were able to get my body to begin to go in the other direction. And so to this day, I still have issues with my platelets. Emmanuel even has some health issues that we just can't explain. And so, speaking of which, there he is. There's my miracle baby. A grown man by God's grace. But it was a very difficult experience. It was scary because if it had not been for my cousin, I could have died. I mean, it's just how serious it was because nobody was paying attention. I had all the symptoms, but the doctor just brushed them off. And so we're here today because that can't happen to anybody else. And so let me go back. So why did I wait 21 years? You always think about doing things, but I had 4 children. It was not really on my list of things to manage at the time. a pastor, for a husband, all those things going on. But I had a situation that I'm gonna move on. I was meeting with a young lady. We were having breakfast, and my husband had to a rush to go and visit someone who had just lost a family member. And come to find out, that young woman that passed away in her bed with her baby. They sent her home. No, never treated her. And she died of a newborn baby. And it was like, oh, gosh, I cannot keep sitting. I gotta say something. We gotta do something, because this is a whole nother state. And it's still 21 years almost, and it's still happening. I'm like, God, that could have been me. If that hadn't been for somebody in another city who knew me and loved me doing something, it could have been me. So we're here today to share information, to make sure that you share, that you have friends, daughters, granddaughters, family members, that you see and you notice that something is not right. You know what? Let's go get that checked out. Let me tell you what I know about some things about preeclampsia, just in case, so you can get the necessary treatment. Amen? And so on today, I want to give, I think everybody has note cards. Yes? So if you have any questions, I'm going to have, some of you already have them. If you don't have them, they're somewhere around there. I know Bishop Tate put them on some chairs, I believe. And so if you have questions as we're moving along, so that we want to really honor your time. If you have any questions, then you can pass those to Miss Ani in the back, and she'll give those to me, and we'll move on from there, okay? And so we want to allow, is it Anicia? Miss Anicia, she's going to share her story, and then we have some questions for our panelists here on today that would just kind of enlighten you more about this disease and what needs to be done to make sure that our African American women are aware of it, and that we save our moms and their babies.
So my story is a little bit interesting. When I have a 15-year-old and a 5-year-old, so this didn't occur until my 5-year-old. And interestingly enough, I went in to the doctor's office at 7 weeks pregnant, like something is not right. So I was already swollen. When I say swollen, I mean I couldn't put my feet in shoes at 7 weeks. Not only was I extremely swollen, I just felt terrible. But in 2009, my best friend, who is Pastor Smith's daughter, she gave birth to my godson at 7 months. She was showing at the 8-week mark. By 7 weeks, I was showing. I just started, noticing some similarities between her situation and my own. She was extremely swollen all of the time, very, very early in the pregnancy. And like I said, her blood pressure spiked. They found out she was preeclamptic. She's at Christ Hospital. At that time, they didn't even do delivery. And they had to deliver him at 7 months. She was there for monitoring. And so when I started to feel some of those same symptoms, we're talking 8 years later, I'm like, something isn't right. Something is wrong. So I went into my doctor's office and I said, can you check my blood pressure? That's the first. And he's like, oh, it is very elevated. I went on bed rest at 7 weeks pregnant. I was not able to return to work until, that was like mid-March. I didn't go back to work until July. I was back at work for 4 weeks and back out again. I didn't deliver until October, but that entire time I didn't wear shoes in the winter. I couldn't wear shoes. I was so swollen, so uncomfortable. I spent all of the time. I was in severe pain. I was physically ill, and they never would call it preeclampsia. They never wanted to give it a name. I also had a Caucasian physician, and then I started thinking back to my 15-year-old. I had some of those same experiences. By the time I was 6 months pregnant, I couldn't wear shoes. That was the first place where the swelling occurred in my feet and my legs. And initially, my doctor with the 5-year-old, when all of this really got pretty bad, he kept telling me it's because I was of advanced maternal age. That may be true, but two things can always be true. So I am at advanced maternal age, but something is also happening with my body, and I need you to figure it out, because that's what you are paid to do. That's why I'm here. I just need you to take the time to figure this out. So we spent a lot of time going back and forth. I did not get a diagnosis until September. I delivered October 3rd. And there was this hesitation to call it. My blood pressure was insane the entire time. Like I said, I was on bed rest at 7 weeks. How does that occur? But for them to, everybody just kept saying my advanced maternal age. Well, first of all, I don't need you to keep telling me that. I know how old I am.
Thank you.
Thank you, sir. But secondly, again, two things can always be true. I can be older, and I can be ill. So one of the biggest things for me has been, if someone asks, I don't mind having the conversation. But I'm glad that we're here today, because people shouldn't have to ask. The information should just be readily available. Yeah.
Thank you for sharing. So I guess I want to start off for our panelists, for those who may be like, okay, so what is preeclampsia again? So can one of you all just explain what preeclampsia is, just, in the most layman's terms for understanding? Anybody?
Well, preeclampsia is a condition related to high blood pressure in pregnancy, but it's usually diagnosed after 20 weeks gestation. So that's probably part of why they were having difficulty calling what you had preeclampsia, because it was so early. So typically when patients present prior to 20 weeks, we begin to think more of it being a chronic illness, like that patient already has hypertension but didn't know it kind of situation, as opposed to the patient has preeclampsia. So, but that's basically kind of the simple form, is that it's high blood pressure in pregnancy, but it's really a continuum of other symptoms as well that can impact other organ systems as well. So it's associated with problems with the liver, problems with the kidneys, increasing risk of stroke, seizures. So there's a lot that goes along with it. Blood disorders. It sounds like you had a kind of another aspect on that continuum called HELP syndrome that leads to low platelets. So it's a kind of a continuum of an illness that can look a lot of different ways, but the very foundation is high blood pressure in pregnancy.
Many people compare preeclampsia with toxemia. Is there a difference between the two?
You want me to? So toxemia, the best way what I can say about toxemia is it's more of an older term, and it's not a term that we use now. So now it's preeclampsia. So, and then there's terms such as gestational hypertension, which is like someone who has high blood pressure but none of the other signs that are associated with preeclampsia. And then there's preeclampsia, and then there could be preeclampsia with mild features or with severe features. So, but yeah, toxemia, that probably, I know by the time I trained, we weren't using that term at all.
Trying to say I'm old.
No, but it's definitely in the literature. I've seen it, so
Okay,
yeah, for
very
sure.
good. All right. So, is there a cause? Is there any known cause for preeclampsia? Anybody? No. No.
No, I don't think there is a known cause. I mean, I think that's part of the research that still needs to be done, you know, as to why is it that some women get it and some don't. What predisposes you to this, like advanced maternal age is a risk factor, for example, you know. So I think we're starting to get that idea, and I think we're also you know, getting to the idea that even race itself can be a risk factor. So I think that's still part of the research. I think once we answer that question, it's going to open a lot of eyes to where we go next.
And because we haven't researched the commonality in the percentages of black women that are hypertensive and then pregnant, so when you look at most research, there isn't a lot of research on diseases where we're disproportionate in. So that's a big, big problem. And specifically, we keep hearing the conversations on maternal health outcomes and instances where a woman is telling the nurse or doctor or whomever, hey, something's wrong with my body, as you shared. But it's not responded to, right? And so, frankly, until there's research that helps support the evidence that we already feel, we're going to have to keep making sure that we know what to say and what to ask and to determine if we need to leave the doctor and go to a new doctor.
Well, and let me just ask a question right there about research, because I think that one of the struggles, I guess, for our community is how do we push for more research on things that concern us? You know, if it's us that's predominantly dealing with this disease, what do we do to help promote this research? Because obviously it's not being done or not being done enough to really begin to effect change.
Well, I think some of it is diversifying our physician workforce. And when you think about less than 5% or about 5% rather of the doctors in the country are African American, we have a long way to go. And most times when you are a physician of color, you have a concern about your community, you want to go back and help, you have interest from a research standpoint. So how do you foster kind of a healthcare system that really encourages diversification of the physician workforce? And then also, I think we as a community need to feel an obligation to get involved in research as well. I know about the syphilis study. I know about all those things and that's not to minimize it, but I know about all those things. We have reason not to feel like we trust the healthcare system. We have a reason to feel that way. But when you think about we need to make advances, we need to make progress. The only way, even when you think about COVID, I mean, Ms. Renee could talk about that. And when you think about COVID and how important it was for us to be at the table and also involved and participants in the research for the vaccine, it makes a difference. And that's when we can start seeing the differences. I always have this theory in my mind and that it may be that black women, we might labor differently. We might have different features of preeclampsia that are no longer even considered diagnostic, like edema. We might experience things differently than the Caucasian woman, but I don't know that anyone's really looking at research in that way. Now, this isn't for you to repeat. I'm just kind of, sometimes I just think about things about, why is it for you and for you, you all had similarities in your stories.
Right.
Someone needs to look at that.
I don't have the answer. Looking at me. No, but what's interesting, I was talking with, her name is Linda Blount, and she's the president of the Black Women's Health Imperative. They are the oldest, longest entity that has been focused on Black women's health. And so she and I meet frequently, and we were talking about this research issue, and she said, I'm going to have to figure out a way to create our own pathway to the research, and that means finding resources that support the things that we feel and know and that they're consistent. And the research population, no different than the medical population, has a fewer percentage of Black researchers. If you look at the research that's funded by the NIH, which is the National Institute of Health, less than 1.5% of the dollars go to Black researchers. So, there are a lot of things, but I think from an advocacy perspective, we're going to have to start talking to each other. We're going to have to start talking and recording it on our phone. We're going to have to start, just like we elevated the conversation with COVID-19, with all of our different beliefs, we were still talking to each other. And I think that's what it's going to take. We can't wait for someone else to figure out the solution for us. We really can't.
Very good. I think it's frustrating sometimes because it's important to you, and you want it to be important to the people who are treating you, and that's very hard and frustrating when they're not concerned, right? I did want to ask a question. I know that you're a medical profession. You work in the nursing field, and you deal with babies all the time. So have you had many experiences with mothers with preeclampsia?
I've had two who've had both preeclampsia. One mom, she started exhibiting symptoms early on in her pregnancy also. I think she was diagnosed maybe 26 weeks. She was induced, so she had to deliver early. A second mom, she showed symptoms for a very long time, and I took her blood pressure, and I'm like, girl, we can't keep on doing this. We got to make a call at this point. So we called her OB. They brought her in. She ended up being induced that night also. So with my clients, we work with a specific population. So all of our moms are 200% below poverty. So they come with a ton of risk factors already. We touch base a lot on trauma, what their upbringing in childhood was like, and see how it also affects their pregnancy. I've been able to make a few pinpoints, as well as our team, to see if some of our moms have higher ACE scores, they're more likely to develop some type of disorder during their pregnancy, whether that is high blood pressure, preeclampsia, gestational diabetes. So yes, we have seen some, and that is just on my caseload, and I have a caseload of 25.
Wow. Amen. What about you, doctor?
Repeat the question again. Just want to make sure I'm answering.
Just as far as treating patients with preeclampsia, maybe an experience that you could share.
Yes, I see preeclampsia often. My patient population is primarily African American, and I see in general higher rates of high blood pressure. When I came to Cincinnati from Indiana, and my population in Indiana was primarily Caucasian. And when I came to Cincinnati, I was blown away by the blood pressure that as women we were walking around with. And I thought, oh my goodness, this is unbelievable. And but yes, I see preeclampsia often. Probably one of the worst case scenarios was a patient I had who had a history of high blood pressure, pre-existing, and she developed preeclampsia right at about 20 weeks. And probably, I'd say within about a week, she was in the ICU fighting for her life. And her baby, she did need to be delivered early. Her baby did not survive, unfortunately, but it was really probably one of the worst cases that I've seen.
As you were saying that, I thought about just as a reminder for all of us, particularly for our younger women, just to be aware of your blood pressure. I think that the food we eat today, the food that our children eat today, we have a lot of people walking around with the silent killer on their back, and they don't know it. When 21 years ago, I don't even think I even thought about blood pressure at the time. And so I guess because when you're young, it's just not something that's on your mind. I think they're probably more aware of it now than we were then because it's so much more talked about, and there's so much food that that they're eating. I mean, the fast food, all those things. So that's just a kind of a drop in there, just to keep in mind for our young girls that we have our daughters to be careful about what they're eating, because those things will set a pattern that you can't see right now. I tell my daughter this all the time. You can't see it right now because they're little and they're bouncing, but we all know that diabetes in childhood is like really high. Children are having heart attacks. We're in a crazy time. So I just want to throw that in. I know that you all are aware of that. Yes.
Well, I was going to say there are a number of risk factors that contribute to our disproportion in hypertension, and one that we can all relate to is race. So we as black women in particular, not only be it a black woman or a white woman, women make the decisions, right? Women are running the households, and in our city, 72% of our households are single female head of household, right? And so when you start thinking about all the stressors, and all the stressors that we don't take time to address because we just got to get it done, or we put one more thing on our plate. And then on top of that, we are living in a society that is racist. We are facing racial bias in so many ways and places, be it educational system, be it our workplace, be it in medical care. And so you don't think about those silent things that we just deal with, but what that's doing to our body. And so it's interesting that you said you came from Indiana, although your population you served were different. When you look at the data about Cincinnati and Ohio, like, we have some of the worst health outcomes. I think of programs like Queen's Village, and I think of Every Child Succeeds, and I think of the work that is changing because women are coming together and talking to each other and can identify with those factors that we all experience, but didn't necessarily have a place to talk about them. Like, those are the risk factors that are kind of silent to us because we're just getting it done. We're getting through, which is what we do. But our children are watching that. They're not watching what we tell them to do. They're watching what we do. And so generationally, we do have a crisis. And we do have to recognize these other factors that contribute to the factors of stress that then increase the prevalence of hypertension.
Yes, I
I
wanted
do
to.
want-
Oh, go ahead.
I was just going to add, because I think this part is important. In my case, I do remember within hours of I had to have a cesarean with my daughter. Within hours, I felt like a different person. Like, it was almost immediate. Like, I felt different completely. But what I will say, because you were talking about how the disease is a continuum, so many other things happened as a result of me not being treated properly. Within 3 years, I had a hysterectomy. I had to have a hysterectomy, but within months, my entire reproductive system had changed within, just from the things that had occurred during that pregnancy. I had ablation. I had to have, it was several biopsies, thing after thing after thing. And after having some conversations and doing some research on my own, I realized all of these things are byproducts of my not being treated properly while I was pregnant with my daughter with this disease that was undiagnosed for so long, for the entirety of the pregnancy for the most part. So I just wanted to make sure that you all were aware it doesn't just stop. It doesn't happen, you deliver, and there's this miraculous thing that happens. For me, I was no longer, I had to have my reproductive organs removed behind it.
Yeah. I wanted to add to your point about knowing your numbers. And I think if I were to give a suggestion to anyone who's newly pregnant, when you're making your registration list for your shower, put a blood pressure cuff on there. It's so important to know your numbers and to have the tools at home to be able to give your doctor objective information. So sometimes for a doctor who may not be so in tuned, if you just say, I'm just not feeling right, that doesn't connect with them. But if you give them data like, my blood pressure is 150 over 100, I've had a persistent headache even after taking Tylenol, I've noticed that, it could be a number of symptoms, but I'm saying that if you begin to think objective, I'm so short of breath, you just happen to have a pulse ox at home and put it on your finger, and now you know, like, oh.
Basically, you have to be your own doctor.
Yeah. And it's what is called is self-advocacy, self-advocacy. And we don't want you to be your own doctor, but sometimes just giving that objective information will say, okay, I'm dealing with someone who's knowledgeable. It keeps your medical professionals accountable for their response to what your concern is. So that's not to patient blame at all. I'm just telling you how doctors think. And sometimes you have to speak in that language. And so the more you learn the numbers yourself, I think you can advocate for yourself.
Well, I think for me, because I had 2 very normal, healthy pregnancies prior to this, I was just like kind of going through the motions, and then, but when things kept going wrong, I think I didn't understand enough. I don't think I didn't research more because I hadn't had any issues, right? And though my sister had preeclampsia, it wasn't even on my mind, right? And so I think I ignored things initially, or when I went to the doctor, I kind of was given those kind of, well, I just don't, but was not advocating for myself enough, Hindsight is 20/20. But again, I don't think I mentioned this, but I did have a 4th child, and I ended up with preeclampsia again. But thank God for my doctor. Before, when I first got pregnant, my OB, I told her my history. She said, "Oh, I need you at high risk." So she immediately, she threw me away. No, but she sent me to Good Sam and put me in the high risk program to make sure that I was monitored. Even with all that, I still ended up with preeclampsia again. But they were on it. So as soon as I had my kind of drop, they put me in the hospital and they monitored me for I don't know how many weeks, trying to keep me because his lungs weren't mature yet. So I did end up with it again. But like you said, I have so many different things that I've had, and I thank God for grace that Lord has kept me. But I've had, and I know in my heart that they're connected. They are the repercussions of that preeclampsia, that first one that just went way too long. So I wanted to ask a couple of questions from our audience. One was, can you take precautions to prevent preeclampsia? I know we kind of talked about monitoring your blood pressure. Are there any other precautions that we can take?
Probably one of the more common things that we're doing now is a daily aspirin. It's a low-dose baby aspirin, 81 milligrams, for patients who are at risk. And there's a list of risk factors, and some of that is pre-existing high blood pressure, pre-existing preeclampsia, obesity, African American race. So there's a number of risk factors. And so if you are pregnant and you have a question about that, that would be the question to ask your doctor. Am I a candidate for a daily aspirin to prevent preeclampsia? So that's one of the things that we do. And if I were to say, another thing would be to start pregnancy as healthy as possible. So sometimes, I've had an occasional patient come to me, 300 pounds, diabetes, high blood pressure. I want to get pregnant. And it's we need to do some work first. Let's get you healthy. before. That may not completely, totally prevent it, but at least we can start working on those things that you can control. Those are just some of my suggestions.
Okay.
I would say being aware of your stressors, because stress is one of those big things or a big factor that plays into preeclampsia. But being aware of your stressors so that you're able to minimize that also. Practicing mindfulness behaviors as well, either taking deep breaths, walking, yoga, being also aware of, like Dr. Lane said, your numbers prior to and during. So those would be mine.
I wanted to go really quick while we have this quick moment to the point that was made about how the condition kind of extends beyond the pregnancy. And I want us to see pregnancy as more than just 3 trimesters. I want us to see it as actually 4 trimesters. So the 4th trimester is your postpartum time. And in my practice, I consider I keep them close to me till about 12 weeks. And sometimes I get complaints, Dr. Lane, I don't have time to come over there, and Dr. Lane, I can't get to, and I say, just when can you come? Because I need you to come in so I can put my eyes on you. So I really consider patients until 12 weeks after delivery my concern in terms of anything pregnancy related. So that's the other kind of little tidbit I would say is still think about it after delivery.
I had another question. It says, can you find out if you are high risk for developing preeclampsia? I think we kind of may have answered a little bit, or pre-exposed testing. Is there anything, any kind of pre-exposed testing, anything that's available?
I'm not aware of any testing per se that indicates that you have a predisposition. I think it's more just based on your history. And maybe prior pregnancies. That's going to give us most of that information.
I have another question. Yeah, is there any? Oh, okay. Thank you. Is there any known cure? I know that they always say the delivery is supposed to be kind of the cure, but as we've talked about, kind of these lingering things. Are there any studies or research about any cures for the after effects, if you will?
I'm not aware of any actual cures. I think at this point we're still kind of a little behind the game in terms of, just kind of treating what presents to us. But yeah, the delivery of the baby is the first primary thing. And for some women, that's all they need. And then their lab values start normalizing. They start feeling better, just like you described. But there is that case when that doesn't happen, and then you're just kind of treating the patient as you're presented with problems. So unfortunately, I'm not aware of any cure just yet.
Now, you mentioned the HELP syndrome. 21 years ago, that was not a term that I'd ever heard before. So can you explain what the HELP syndrome is supposed to be?
The HELP stands for hemolysis, which is like the blood vessels are breaking down. It's elevated liver enzymes and low platelets. And so it's kind of a mixture of all those things. And usually when a patient has HELP syndrome, they're pretty sick.
Yeah.
You're concerned about your patient's life when they have HELP syndrome. So you were really sick. And thanks be to God that you're here today to do this, for sure. But yeah, so it's on that continuum, as I say.
Wow. Even just to hear it sometimes, like, wow, we were almost gone. I always tell Emmanuel, I said, boy, your name is Emmanuel. God is with you, buddy. The enemy tried to kill you, but God said no. And so, I remind him of that all the time. Did anybody have any more questions that needed to come up here? Okay, thank you. Oh, and while I'm getting that, I did have another question. How does preeclampsia affect the baby?
Probably one of the main things is that it can affect the growth of the baby and the placenta's support of the pregnancy. And so that's probably the main thing, and increases risk for, depending on It depends on exactly like what you're experiencing. But you could say that over here is risk of stillbirth just based on all the potential complications that you can have related to preeclampsia. So, but the main thing is the growth, and if babies are not growing as they should, and if the placenta is not supporting that pregnancy as it should, then babies can pass away before the day of birth.
So that brings me to my next question, and this is one of the things you kind of mentioned it when you said that didn't want to say preeclampsia, and you kind of alluded to a little bit when you said that because it was early, but as she said, they didn't accept it or even acknowledge it until right before you delivered. One of my now this is this 50-something brain, y'all. Woo! Okay, so let me come back and think about it. So you talked about that. My question is, we in Cincinnati dealt for a great period of time with infant mortality. But all throughout that time, I know Cradle Cincinnati and a lot of organizations were formed and really working on Every Child Succeeds, really working to combat infant mortality. But my thought is, and my question is it possible that some of that infant mortality was because of some undiagnosed preeclampsia?
You know, I don't know the statistics here in Cincinnati specifically as to the cause, so I can't really speak to it. Is it possible? You probably could make that connection, but it's difficult to say without looking at the data. And I think this is just a nice time to talk about safe sleep as well, which I know is a really big factor that's not related to preeclampsia, but babies sleeping in a space alone on their back, that's going to keep them to prevent death during that time right after birth. But yeah, I'll have to look at that in regards to any data related to did the moms have preeclampsia during their care.
I just wanted to add that the World Health Organization says that infant mortality is an indication of the condition of the community. And so there are all of the factors that affect our quality of life are factors that contribute to our survival, be it our survival or baby's survival, a mom's survival with pregnancy. And so, again, because we don't have a lot of research to be able to confirm and state what we know and see and experience in our communities, right? One thing I just wanted to bring up, since it is Preeclampsia Day and month, is the fact that there's another conversation around preeclampsia, which is how it relates to long-term heart disease. So when you have had preeclampsia, you have a 50% greater risk of heart disease later in life. And so that is a fact that is just beginning to be conveyed. And then there's not a lot of research, but it is a factor in what I guess, and so there obviously isn't research, but I don't know who has decided to say that it's a 50% greater risk, but they have made that statement in the Preeclampsia Foundation, and it's starting to be more of a conversation, which is making us be more aware of our blood pressure. So again, it's knowing your own body, and as you said, being able to advocate for yourself.
Wow. Okay, so here's a question. Within legislature, what can we do? That's the number one. So that's the first question. Within the legislature, which is a whole nother, I feel my blood boiling. But anyway, what can we do?
I think it really comes down to policies and resources, financial resources, basically policies that will drive money to where we need it, to organizations that can make a difference, to research that can answer some of these questions that we don't have today. And the legislator needs to make it an overall health priority for the community when we talk about that being a sign of the community of health. Those are just my 2 cents as a doctor.
So to get to policy, you have to first elect people who are going to represent you. And so we need to understand that.
First, you got to vote.
Well, I was get to that, right? And so, yes, first we got to vote. And so it's always very interesting to have this debate. And I had this debate with my 22-year-old who said she wasn't going to vote anymore. And I said, well, oh, okay. Well, all right, well, don't vote anymore. Okay. But I don't want to hear you say a thing about what happens in this country. Okay. Because how much money and effort has been spent to not allow us to vote? We got to think about that. Now you don't spend all that time trying to get people to stop voting. If you don't understand, if everybody that can vote votes, we already hold the power. And so we don't get to new policies. We don't get to legislative action that is responsive to our communities until we are greater representation of the people voting.
And then we don't have the information to create the policies or legislature because we haven't done the research. So it all goes back to research.
And it's about getting involved. You know, we got to get involved. Oftentimes, when we don't think, I say that, when you don't think it affects us, we just kind of dismiss it. But it all affects us. You know, what affects you affects me, and I think that it goes to that. I am my brother's keeper. We have to be concerned about. You know, I may have not ever suffered from that, or experienced that, but we ought to be concerned enough to come together to find a way to make it better. And I think that's one of the things that we as a people tend to struggle with, is that coming together piece. You know, and I think that, you know, my prayer is that this next generation or three will do better than we'd have, to come together and learn, do the research. You know, this is one of the, and this is the whole, I don't want to go on soapbox, but when we talk about education and the lack thereof, why it's so important for our children to be educated, because how are they going to advocate it and understand policy and know how to go and to advocate for themselves and for the future if they don't even know how to read. So that's a whole nother discussion.
The other thing I think we can do is really address some of those social determinants of health that impact our health overall. I saw a stat once that social determinants of health can impact about 40% of our actual health. And social determinants of health have to do those things that aren't really like specifically health related, like going to a doctor. It might be just your education. It might be how much money you have. It might be your ability to drive here or there to a grocery store that has fresh produce. I mean, there's a lot of different things that can impact your health that don't specifically have to do with a doctor per se, or a nurse practitioner, or a midwife, or, you know, and those things, if we can get policies, if we can vote for policies that can help in those areas, I think that can make a difference.
You didn't even mention the environmental factors,
Yes,
like the water we drink.
Yes.
What are the carcinogens that are in the air around us
Yes.
because of other factors? So but again, when we know, and that's us kind of learning, finding it ourselves, and then raising the question, wherever your voice can be heard, raising the question.
Okay, a couple more questions. What percentage of African Americans are diagnosed with this illness?
60%. Black women are diagnosed 60% more than white women or any other race. 60%.
Yeah, it's a serious issue. What are some cultural commonalities that may be part of the cause? Hair relaxers, beliefs on weight, aesthetics? Yeah. And okay, what are some cultural commonalities that may be part of the cause? Then we have maybe hair relaxers, belief on weight, aesthetics. Who asked this question? Go ahead. Oh, okay.
make us more prone to, oh, thank you, make us more prone to having this illness later in life, like from birth and on. I mean, you guys just tapped on environmental and social issues, but directly within the household? Like, what are some common things? Like, what I know it goes back to data and it goes back to the research. Just in this room, what can we think of that maybe like, you know, hadn't been thought of before?
Everybody says,
No. I know.
I don't, wow.
In terms of, there are some issues that social media will bring up that I don't know that it really has really good teeth in regards to evidence-based answers. But what I would say, which is a little bit related to what you're talking about, is the fact of just being Black or African American is a major, major factor, major factor. And Ms. Renee, she hit on this issue of implicit bias, which really is, what are those kind of unconscious judgments that are made by healthcare professionals when you encounter them? And they don't even realize that they're making a decision based on a bias from what they see. So just by you being a Black female, what are they, it just immediately sends their mind down this algorithm of how they should manage the problem, whether it's related to high blood pressure, whether it's related to pain, whether it's related to a number of issues. So I think one thing is understanding that just by being Black and African American, we are at risk. And the other thing I'll tie into this really quick is there was a model that was developed many years ago, and it talked about 3 delays and what are the delays that prevent individuals from getting the care that they need. And one of them is just a delay to, it's kind of like a delay to seeking out care. And so one way to prevent that delay is going back to the know your numbers, knowing the signs, asking for your blood pressure cuff when you register, so that you can start basically giving yourself the tools that you need so that you can survive. In many ways, we should feel like, I hate to say it, is this a strong word? Like we're going to war about our health. We need to feel that way and not feel like, okay, well, this doctor didn't want me to go in, so I'm not. You need to have some sense of, like, no, I'm not going to give up on that.
And I think it's just, I think it's self-advocacy, really. Right. I mean, you got to advocate for yourself. You got to recognize, first of all, if they're not advocating for you, it's time to find another doctor. I think somebody said that. Right. And, you know, again, hindsight is 20/20. This doctor that I had, he delivered my previous son, my oldest son. So but I had a normal pregnancy, no issues, everything was fine. So I didn't think anything about it. I didn't, you know, I think, and I was young too, y'all. You know, but I think that is a piece of it, but we have to be paying attention, you know, and we have to be diligent about everything, knowing that just being an African American is a risk factor. That means we have to be just that much more attentive to what's going on in our bodies. You know, you know, we just got to be paying attention. Yes, ma'am. Should you take her mic, please? A couple more questions than that, because I want to keep you all too long. We are a few minutes out. Right there.
Her mother, no less. You know, I had an experience, and I'm just going to share this very briefly. I had an experience where I saw a doctor. This was locally. She was a breast surgeon, and I've had several lumps and so forth removed from my breast many, many, many years ago. And I had something that I felt was a lump. And I made the appointment, and I went there, and I got the distinct impression, and it was very disturbing to me, because I really felt that she really didn't care. Her whole demeanor when she walked in, she was of not of Asian descent. She looked like she could have been part Cherokee or something. I'm not sure, and I'm not saying that with any disrespect, but I just don't remember. But anyway, she refused, or rather said that she had already checked the glands, even though she never told me to hold my arm up. And when I thought about it, just before she sent me for an ultrasound, I said, well, have you checked the lymph nodes? And she says, I did. I was like, okay, honey. I said, okay, because I just thought that might be something important to do. But she seemed, again, like she really didn't want to do it. I got the distinct feeling that it was more racially motivated, her attitude, than it was anything else, and I was very insulted. But she wanted me to do the ultrasound, which was an additional cost, and I had just had, not only 2 months before, my regular yearly mammogram. And I was like, okay, they're going to charge me $9 million, and this woman don't even want me to do nothing. She's not going to check nothing. She wants me to get another test, et cetera, et cetera. So I was very unhappy. So it's important, what you guys are saying, that it's important really for us as women to trust the professional person that's taking care of us and to present to them any issues and concerns that we have, so that when we leave the office or leave the test or whatever, we feel that those things have been addressed, so that we don't carry that with us and sometime later find that there is something wrong when the doctor either didn't care or didn't test further. So that's just my thought. Thank you.
Any other questions while the mic is moving around over there? No? Okay.
I'm actually going to give if I might, a quick suggestion to some. My sister mentioned that I also had preeclampsia, though it was called toxemia in 1919. So that being said, I had one of the best things that happened in the early part of my pregnancy is I had to go to my general practitioner, or no, I actually had to go to our nurse at my job, and it was part of their practice to check the blood pressure. That's the first time they recognized that my pressure was elevated. So that's so I say that it's really important to get your blood pressure checked, as was mentioned. Another thing that I found out for myself is that it's really easy for us to ignore warning signs and try to make it like that's not really something. And that's really where a lot of the problems began with myself. I felt certain things, and I didn't necessarily share them with my doctor right away. Though, as any pregnant woman, you're going, quite often, and so they might catch it, but they might not. So I wanted to make that suggestion. And if you find that you have a doctor that doesn't have what you are looking for, it's always okay to get a second opinion. And don't feel like you don't have options. You are the best advocate for yourself. So if you don't feel well, don't let somebody make you feel or discount what you feel and tell you that you're all right. I ended up having to have being put in an induced coma and nearly died. And my precious 1 pound, 13 ounce baby girl is sitting behind me. So to God be the glory. So I just wanted to encourage all the mothers. I don't know what people's faith is in here, but prayer changes things. And so I pray that each one of you all believe that God will get you through it. And then it's okay to ask questions if you're not sure if there's something wrong.
All right, ladies, what y'all doing over there?
Just want to make sure we don't have anybody outside.
All right, we're at the end. Go ahead.
Hey guys. Okay, so I don't really have a question, but speak with other women who have had children before you. So when I was pregnant with my son, it was smooth sailing through, but by the time we got to the end, I started experiencing heavy swelling and high blood pressure. And so because my mom has had it previous with both of my brothers, I made sure I communicated, hey, something's wrong, I don't feel well. And instead of us waiting like we did with her, we immediately went to the hospital. And I had my son the next day. So I was grateful to have caught anything that it could have been previous because I shared the things that I was experiencing right when I felt them. So making sure that you communicate anything that you feel as soon as you feel it and not thinking like, hey, it's okay, maybe I'm over-exaggerating, maybe it's nothing. Share those things as soon as you feel those things because it could be something bigger later.
And I like that. That's my daughter, by the way. But she was aware, right? So she knew that there was something that she needed to be watching for, and that's why we're doing this. We want to make sure that everybody's aware. Maybe it's just a friend. Maybe it's a friend's daughter, and you're talking to them. They're saying, you know what? I learned about preeclampsia. What are her symptoms? And begin to examine those things so that we can support one another. And maybe you haven't had any children yet. Now you have some information so that whenever that time comes, you already know. You know that this is a potential because I'm African American. I already know that there's a potential that I could have some problems. So now let me do my research. Let me kind of plan out. Let me prepare my body for pregnancy, the best I can. I mean, I don't know if there's any real preparation. Woo! Definitely none for parenting. But however, making sure you know your blood pressure numbers. Those things, all these things are so important because we want to make sure that we don't have these numbers. 60% is ridiculous. And what that says to me is, yes, we have a high risk factor. But what it says to me is that there's not enough people know. They didn't know. They didn't know they were sick. They didn't know that that was a sign of something that could kill me. They didn't know it. So when we have numbers that high, it is I don't know about for the professionals in the room, but I just feel like it's a sign that there's not enough awareness. There's not enough knowledge. Not enough people know that this could be something that I experience, right? And we don't want to have that continue to happen in our communities. We are our advocates. We know that we live in a world that does not necessarily care whether we live or die. In many cases, we're seeing it in every sphere. We're seeing it all over. And so when we know that, yeah, we need to advocate. I'm all for that. But how about we take care of each other? How about we advocate for each other? How about we make sure that if they never say a word, if it's never on the news, if nobody ever does the research, we have made sure that our neighborhood, our family, our friends know so that generations will have an information and these numbers will never be this high again. Can we agree with that? Amen. So I want to conclude. Any other questions? I don't want to leave anything. Anyone want to say anything? I see my baby. She keeps on raising her hand. Yes. Is that our little miracle baby? Yes. That's wonderful. I love it. I love it. Did she have a question?
She actually had several questions, but they were related to the speaker, the actual speaker.
I just love little
Adorable.
people.
It was
I love
priceless.
it. I love it. She's 5, right? Yeah, she's 5, y'all. Y'all remember the 5. I love it. My grandson's 6. I get it. I do want to. Oh, go ahead, Crystal. Crystal.
I'm
there you are.
sorry if I missed this part. And I know it's not a lot of research, but is there anything correlating between like kidney issues and diseases with preeclampsia? If anybody has any knowledge.
I would just say, I would think that if you have a chronic illness such as a kidney problem, if you already have high blood pressure, if you already have diabetes, those things can increase your risk for conditions like preeclampsia. So anyone who has a chronic illness like that and you're thinking about pregnancy, you should really have something called a preconception counseling appointment. And what that means is before you get pregnant, you go and talk to the doctor about those risk factors that you have what do you need to be concerned about, so that you can make an informed decision as to whether or not this is the right time for you to get pregnant, whether you should get pregnant, and you'll know what to expect too. So it's called a preconception counseling visit.
Now, I didn't know, were you speaking of kidney issues after having preeclampsia, or did she answer your question?
Basically, she answered it. Like, I found out after I had preeclampsia that I always had this issue.
Okay.
So I found out I had the kidney issue because of the complications with pregnancy. So, and I know, like in our community, high blood pressure is really what people think about, but they don't, when you get to the cause of high blood pressure, a lot of people don't go to kidney issues. They're quick to say sodium. So it's like, you adjust all the ways you eat. Why am I still getting sick? You know what I mean? And stuff like that. So it took all of that, almost that, and being put in the hospital and all that stuff just to come back for a nephrologist who has absolutely nothing to do with pregnancy to come and say, figured it out, once he did all the extra testing of whatever numbers they look up, every specialty has their specific test. And it wasn't until then that they figured out, this is the issue. So mine wasn't necessarily a blood pressure issue. My kidney caused my blood pressure, so I was more on the kidney medicine than I was the blood pressure. But of course, with pregnancy, the blood pressure shoots up. So, and they hate to give you more blood pressure medicine when you're pregnant. So it was one of them little vicious cycles where, just trying to figure it out. But my thing is, if you know your family history, and your family history has kidney issues and things of that nature, that's just something to know in advance. You know what I'm saying? This may be something I have to deal with because I know our history is like that. That's just, like you said, hindsight is 2020. Finding out after the fact makes me be like, well, tell them to look at your kidney. Like, I don't know what it could be, but tell them to test that because ain't no telling what it is. And because it's so many different things that can cause your blood pressure to shoot up, now I be running around telling everybody because I didn't even know what it was before all of this. So yeah,
Well, you hit on an important point, which is how we share information in our families, or we don't, because there was a time that it wasn't recorded, right? So, we sometimes we don't know, but sometimes you just have to ask questions of everybody in the family, okay, and because we just don't think to share what we've experienced.
And the whole family, if you have children with different fathers, you need to know all the history. And I think oftentimes we don't, whether we can find it out. I know there's sometimes when you can't, but find out all the information you can so that you have a well-rounded knowledge of what your children may experience. All that is so important, and I know it's not often done, particularly in our community.
Just a moment ago was just very apropos because it's not on. Go ahead. Okay. Anyway, what you said is very apropos because sometimes there are questions that we may need to ask, and we as people, not just in families, we as women in particular, we don't share information. We don't carry information that might help someone else to someone else. Oftentimes, we're afraid that they'll know more about our business than we want them to know.
Right.
Or we
Some
think
of that's
that they'll
generational, though.
It's generational, and that's true. And that's true, but I'm still saying it happens. It happens. And so if you don't share it with somebody who might have a word, an encouraging word even, or may have information that may help you, then you miss something that you could have had if you just shared it. Talk to somebody about it.
Well, you are saying something really important, which is we haven't normalized really feeling safe and talking to each other. And when we can get there, then we can save each other. So
Yeah, trust is always an issue, and I think some of that kind of comes with age. Is like, who cares? So, listen, it. Okay, here, let me tell you more, since you want to know so bad. But yeah, I'm just saying.
That's
I
what
think
was going to say that's what I like about this event in particular because, each of us has a testimony. I mean, it could be your illness that you had, your experience at work, a relationship that you had, and you've really learned a lot from that experience, and you've come on the other side, and just the love that you have to share your story. You don't know how many people you're going to touch, and just the fact that she mentioned, well, check your kidneys. I mean, that might save someone's life to tell them to check their kidneys. So I think that's what's beautiful about your event is that you've really encouraged us to think about what can I share so that I can help someone.
Exactly. Wonderful. Well, I am thankful for all of you all that have come on today. Those who may get to see this online later on, just for the information, for the sharing, for the privilege. Okay, I see you. That I'm going to give you the mic 1 second. I do want to say this. The Lord gave me this a while ago, and I feel like this is the time. He gave me this word called peacock. Right? You're familiar with peacocks, right? Peacock, which stands for Preeclampsia Awareness Coalition of Cincinnati. Preeclampsia Awareness Coalition of Cincinnati. And so I was like, okay, what does that look like? First of all, he gave me the significance of a peacock. It represents eternal life and the resurrection because it sheds its old feathers and grows new ones. And so as I'm listening and just trying to figure this out, I think that this is an opportunity to continue this conversation. Yes, this is Preeclampsia Awareness Month, but we have to continue it because we have to make sure that we tell as many people as possible. So I'm seeking women who've experienced it. I'm asking, if you've experienced preeclampsia, come and share your story so that we can continue to spread the information to save lives, right? And so I invite you to be a part of that. I don't know fully what it looks like yet, but I know that it's something that's on my heart to do because one time is just not enough. We've got to continue to share information. I know that there are so many of us that have this testimony, and we can share with one another, but we also can help to kind of pinpoint do our own research. What symptoms do you have? Well, I have this, you have this. Okay, so we know that this is something that's common. These are things that we are discovering so that we can share with someone else. And so information, wanting to make sure that people are aware. So I invite you to be a part of that as we grow it to build awareness throughout our community in Cincinnati. All right? I know I have one more question back here, and we are going to, 2 questions, and we're going to put you on the clock because I promised we were going to be done at 7:30. Go!
Okay, I really didn't have a question. It was just more so I'm glad that you all brought awareness because everybody pretty much answered what I had a question for. I'm only 26. I just turned 26 this year. I recently had a close friend of mine die from preeclampsia, and she also lost her baby. And this was a planned pregnancy, so this wasn't something that she would think would happen at 26. And I feel like our generation associates health with our age. And I feel like it's something that we all should also make sure our men are aware of because we talk about making sure we're aware, but they also need to be aware, especially if they're in the household, what symptoms should they look for because they have to advocate for us as well because we'll feel certain symptoms like, oh, I'll just sleep it off. And she died in her sleep. And I feel like that's very important that we, especially as younger generations, talk to our friends about, yeah, maybe the fries from McDonald's ain't what you need to do today. Or making sure that we advocate for them as well and us coming to this symposium is really important to spread throughout our community because she was African American as well. So thank y'all for this.
Thank you for sharing that. And see that exactly. Thank you for sharing. I'm so sorry you lost your friend, but this is why this is so important because and with your generation, it's just not known enough. It's just not known enough. It's not discussed enough. Thank you, Mother Dove.
I'm thinking I never heard the word before, preeclampsia or whatever, but I was wondering because it does have the problem high blood pressure connected to it and whatever. My interest is being that we as a Black race are coming together, sharing information on situations we deal with in the medical field. I'm someone that's in a nursing facility now, and I was just hoping that maybe in the process of coming together, as we've started, we're going to continue to share information. Could we get more information on what's going on with the blacks in the nursing facilities? It's really a sad situation when you're dealing with the doctors, the nurses, the aides, everybody involved. Is there anything that our community can do to help that situation out? And I was wondering about, like I said, I don't know if I said it or not, but does this preeclampsia work if pregnancy is not an issue at all? Can the body go through the same symptoms without the pregnancy? You know,
Right. Well, I think with preeclampsia, you need pregnancy to have that diagnosis. Mhm.
all right. Because I know high blood pressure is something I found. I know the kidney is somewhat connected to the bladder and all that stuff like that. So
Yeah. Yeah.
Blood pressure is not. I was just gonna say when blood pressure is not managed, that's what happens to the rest of your body.
dependent on nurses and doctors and aides, whatever, manage those things for you, then, I mean, how do you deal with that?
That's a hard one.
It's a big mess, believe me. I've been in 3 different nursing facilities now, and they go from bad to worse.
I think it is just a sign for us as a community
Right.
to be aware of what's going on in our community and talk about it. Because we don't, my mom always says all the time, you don't ever know when that's going to be you. You don't know if you're going to end up in a nursing care facility. And so even when we're young and we have our lives and all the things are going on, we have to be concerned about those things because we don't know. And if there's no advocacy, if there's nobody talking about it to know what's going on. I mean, because some things I know because what you told me. If you hadn't said it, I wouldn't know. I think COVID exposed a lot of that stuff, right? A whole lot. But again, advocating, talking, sharing, finding out how we can help one another so that we can be a better community. We have the power to make the change in our community. It's us. It's us. We are responsible for our children, for making it better for the next generation. And if we don't open our mouths, we don't share, we don't make sure that we're advocating, we hurt the next generation and the next generation. So what are we going to do about it? What are we going to do different? We've got to stand up. We got to speak up and be our brother's keeper. Everybody
What's our
agree?
bottom line? Doesn't it really go back to food, water, sleep, exercise, to the basics of life? And if we're going to get away from all these sicknesses that we have been labeled with, why can't we start with our kids by not giving them all of this processed stuff?
That's a whole nother class.
This is the basis of the whole problem.
Yeah.
Because I lived over 70 years before I even thought about sickness, in a sense. You know what I'm saying?
Yeah.
So we got to get all the way down to the basics.
Yeah. I agree.
About
All right. Well, I want to thank you all so much. Thank you, thank you, thank you. I ask that you give all of our panelists a big round of applause.
Thank you. Thank you.
I'm just so grateful for you taking the time. I'm grateful for the information, grateful for the sharing, and really excited about doing something different. Maybe it's not preeclampsia, maybe it's another area. We have a lot in our community. But, we have people that are working, that are trying to make sure that we're aware and we're getting the necessary help. And so let's take advantage of those things and let's do something different. So I thank you all for your time. Thank you for being here. God bless you. Have a safe travel home. In Jesus' name, amen.